Thank you. Good afternoon. I'd like to call to order this Renfrew County Housing Corporation meeting. It is Wednesday, May 15th, and it is 1 o'clock. As we gather this afternoon, I would like to acknowledge on behalf of Council and our community that we are meeting on traditional territory of the First Nations. We would like to thank the Algonquin people and express our respect and support for their rich history. We are extremely grateful for their many and continued displays of friendship. We also thank all the generations of people who have taken care of this land for thousands of years. Has roll call been taken?
Yes, thank you, Chair, and we have quorum.
Thank you. Any disclosures of pecuniary interest and general nature thereof? Seeing none. Adoption of the minutes of the previous meeting. Could I get a mover and a seconder, please, for the adoption for the April 10th meeting? Moved by a councillor from Whitewater, seconded by the councillor from Petawawa. All in favor? Carried. Delegations. There were none at the time of mailing. Director's report, please.
Thank you, Chair Giardini, and through you to the board. Good afternoon, everyone. Nice to see everyone this afternoon. The director's report starts on page 5 of your package, and I have 2 information items regarding the capital housing projects update and the new build at 1030 Lee Street in Pembroke. And with your permission, Chair, I'd like to turn that over to Mr. Raditz to overview those 2 items.
Yes, Mr. Raditz, please.
Thank you, and through you, Chair, to the committee. In the information item 1 in the attached appendix is the update and status of the current projects. I would like to highlight the project for 202 Cecil, and as you can see, it's indicating we're at 98% complete, so we're pretty well almost at the finish line, so it's a good news story. We expect that the project will probably be finished this week, potentially. So saying that will allow tenant occupancy for the end of June, early July. And I'll just move on to information item number 2, and that's an update on the new build at 1030 Lee Street. And as you can see, we are at about 95% complete, and Tina has put some photos up on the screens. So there's about 2 weeks work remaining for that project, and again, the good news story there that by the end of June or early July we'll be ready for tenant occupancy. And I think there was just the 3 pictures, correct, Tina? Okay. And Chair, I'll just stop there.
Okay. Are there any questions on information item number 1? Information item number 2. Very exciting times. We're looking forward to the day when our tenants do move in, and good work, everybody. It's been a long time coming. Mayor, Ward Nemo, please.
I'd like to express our appreciation on numerous fronts, but specifically to Associate Minister Flack, who took time out of his schedule, which is quite demanding as a minister, to spend some time with us and open our project. Also to MPP John Yakubuski. It's always exciting for him, I think, but especially for us to be able to show Minister Flack, any minister, the innovative approaches we're using to meet the needs of our community. And then also to Mayor Ron Gervais, who was there as well. Again, he's a very enthusiastic partner, and we're fortunate to have him sitting in the mayor's chair, quite frankly. He works hard, listens well, and asks pretty knowledgeable questions, and then makes things happen. So we're lucky to have him involved as well. I'd like to thank Mr. Kelly, and through him, Andrea Patrick, and all of her team, because I know that it's the size of the production that went on Friday. You had to have all hands on deck. And so I'm so glad that we did a long time ago talked about cross-training and integration of the departments, because it certainly shows, with the full unit showing up to do so many things. And then again, note of congratulations to Jason Davis and Mr. Raditz for their work too. It's a beautiful, it's a really beautiful set of units. Fresh, doesn't look the stodgy, patented community housing builds that have been going on for the last 100 years. It doesn't look like that. It looks very new. You could almost see it perched as an Airbnb on the side of a hill near the ski hill, in terms of just the fresh look of it. So again, thank you very much. Really successful project and a very special day for everybody. And it was due to everybody's efforts in this room and in Ms. Patrick's department. So thank you.
Thank you, Warden. Okay, we move on to resolutions.
Thank you, Chair, and through you to the board. So the resolution is a memorandum of understanding with Community Living Upper Ottawa Valley. May I go ahead and read the resolution, Chair?
Please.
Okay, so the recommendation is that the Renfrew County Housing Corporation Board of Directors enter into a memorandum of understanding with Community Living Upper Ottawa Valley to designate 2 units in the community housing building located at 1030 Lee Street, Pembroke, Ontario, to tenants on the centralized wait list who are receiving community living supports.
Can I get a mover and a seconder, please? Moved by the member from Head Clamaria, seconded by the member from Whitewater. Continue with the background, please.
Thank you, Chair, and through you to the board. I'd like to start the background just by introducing some guests at the back of the room from Community Living. We have Tina Williams, the Executive Director, and Brad Switzer, who is the Finance and Property Manager. So welcome, both of you. Thank you for being with us today in the chambers as we talk about this Memorandum of Understanding and partnership between the Renfrew County, or proposed partnership between the Renfrew County Housing Corporation and the Community Living Upper Ottawa Valley. So the Memorandum of Understanding, which is in your package, the proposal is to designate 2 units within the new build at 1030 Lee Street to eligible applicants on the centralized wait list for Renfrew County Housing Corporation for a 15-year period, and in exchange for a donation of $200,000 from the Community Living Upper Ottawa Valley. So I think that this has really been a partnership that has been, we have an ongoing partnership with Community Living. We work with them very closely in many of our areas of our programs in community services. We also have, many individuals that do receive supports from Community Living that are living within our properties across Renfrew County. And we work very closely with the organization and with their staff in supporting individuals that, need services from both organizations. To provide just a little bit of additional background, I think this is something that has been discussed for a few years, and you're seeing these discussions that have started before I was in the seat, but have culminated and gained some momentum over the last few months. And we're really pleased to be bringing this forward this proposal. Community Living is seeking, as an organization, to move a little bit away from owning and operating their own housing units, but while still maintaining some, ensuring quality housing for residents that they're supporting. And I think for the Renfrew County Housing Corporation, we do ensure that we support vulnerable individuals, and we make sure that we are having buildings that are very diverse and that we have individuals from numerous backgrounds who are eligible on income and asset limits to be living within our building. So we do see this as a win-win for both organizations. I think as council has directed staff, we are seeking opportunities as the senior leadership team to look for ways to be innovative and to potentially do some things differently than maybe we've done before in order to increase revenues to help offset, some of the expenses around maintaining our aging buildings, as well as for some of our new projects and helping to increase affordable housing builds and supplies going forward. So we're certainly very well aligned, the organizations, in terms of our dedication and our supports of vulnerable individuals and wanting to provide, safe and quality living spaces for individuals that we're supporting. So I will stop there, Chair, but happy to answer any questions that the board may have.
Thank you. Are there any questions? Mayor, Councillor from Petawawa, please.
Thank you, Chair, and through you. I think this is an amazing opportunity and a great collaboration between the county and community living. It was only a couple of months ago we had a delegation come to Petawawa Town Council, and their main focus was on individuals who have special needs and parents who are getting older and not always capable of looking after an adult with special needs. And they were looking for opportunities or vacancies where these individuals could go and live independently or independently with some supports, and there was not a lot around. So it's good to see that we're taking steps to provide housing and opportunities for these individuals with special needs to have. So it's a great first step, and hopefully this is just, you know, the wedge in the door, and we're going to have a lot more opportunities to fill a need that is definitely here in our, not only in our area, but across the county as well.
Thank you. Any other questions? Councillor from Whitewater, please.
Thanks, Chair. I'll echo points from Petawawa. And the question I'll put forth is the limitation. Like, we only selected 2 of the available, I think 8, if I remember the right number. Is it funding, or is there, what would constrain us from offering or being able to provide more? What's the list look like in terms of folks in line for accommodations with community living?
Ms. Patrick, please.
Thank you, Chair, and through you to Councillor Nicholson. So I think, you know, as Ms. Williams at the back of the room and myself have discussed, I think, you know, there is nothing, you know, we have many individuals that are receiving community living supports in our buildings already. This proposal is to reserve the units for eligible individuals that are on the wait list. So I guess for the community living organization, they don't need to have a concern that if somebody vacates the unit, that they wouldn't be able to continue to have that space available for another tenant that they're supporting. So this is where, you know, the proposal comes from, and we thought that, you know, certainly you know, the building and is, you know, a perfect opportunity to look at that. We, of course, were very fortunate to receive funding from the province of Ontario to create, you know, this affordable supportive housing building in our community, and think it's an excellent facility and very nearby to the community living offices as well. But there's also, you know, it's a great community, and there's some other properties that we own nearby as well. And so, as you'll see from the MOU, there is the opportunity if there were to be other, you know, opportunities within other buildings to move those 2 units around, that would be fine as well. It's the agreement to keep the 2 units within our properties that are designated for tenants that are receiving the community living supports. Hope that answers your question.
Thank you. That answers my question as well. Any other? Councillor from Petawawa, please.
Thank you, Chair, and through you. So just to follow up on that line of questioning, is there any provincial mandate or policy that states we, as a county, have to provide a certain percentage of these units for those who are receiving support from community living?
Through you, Chair, to Councillor Service, there is no provincial designation around that particular vulnerable priority group, in my mind. The province of Ontario does designate special priority access must be given to victims of intimate partner violence and human trafficking, which we do, but other aspects of our centralized wait list, we have the autonomy as a service manager to navigate that and make some of those decisions around prioritizing based on the needs of our community. Thank you.
Are there any other? Warden Emo, please.
Thank you. It's really impressive to see this. I think what you have is 2 organizations that are charged with housing some of our most vulnerable people in our society and in our community. And you know, it's also good to see that we're not competing for funds for new builds. I think this makes sense, and I know that community living has been moving more and more to this in the last few years. I remember a presentation to me, I'm going to say 10 years ago, where they were talking about getting rid of some of the stock that they had to be able to move to more of a relationship with the landlord with support for the clients. And I can't say enough about the need to make sure that we model diversity and integration into the community for all people within our community. So this is, on many levels, this is the right thing to do. So congratulations to you and to Ms. Williams for putting your heads together and coming up with this.
Thank you. Any other questions or comments? No? Okay, I'll call for the vote. All in favor? Carried. Okay. Could I get a mover and a seconder for the director's report, please? Councillor from Petawawa, seconded by the councillor from Whitewater. Thank you. We'll go on to the manager's report, please. Did we not vote? All in favor? Carried. Oh. Okay, continue, please, Jennifer.
Good afternoon. My report begins on page 12 of your package with several information items, starting with the Treasurer's report for the first quarter of 2024. So within this report, just to highlight for your reference, it's only reflecting the first 3 months of the year, and there's no anomalies or no concerns to highlight. If you were to look over at the very bottom of the report on page 15, you will see that there is a municipal surplus deficit of just over $490,000, and that has to do with the timing of our revenue sources. So provincial transfers, for example, being deposited over to our care. Information item 2 is an update regarding the 10-year housing and homelessness plan that is underway. So we are pleased to let you know that Renfrew County Housing Corporation has engaged services from Ian DeJong and his company called Org Code. Within the report, you'll see that there's a link there that you're able to learn more about his organization. Ian is well known throughout Ontario and nationally, as well as across North America, for the work that he does in addressing homelessness and the strategies to support that. We have a very ambitious schedule ahead of us with Ian in the upcoming months. That will involve several steps. Right now, we are working on data collection, and we're working on finalizing a summary that will go out to the public for opinion and feedback. And we are also in the process of organizing several meetings, I believe 8 to 10 meetings during the week of June 17th that will gain valuable feedback from important groups, including those with lived experience, those with lived housing experience, the general public, the business community, council and staff, and so forth. All of this will result in a new 10-year housing and homelessness plan, ambitiously for September. So that's what we're going to hope for, if not October. And from this, we are hoping to have advice, feedback, ideas to form next steps. Do we have approaches right now in place that are right size for the community? Perhaps there's other ways that we can consider using the homelessness prevention program funding, all things that we are hoping to uncover within this exercise. The third information item is, again, an update regarding the new construction that we have underway that we are incredibly proud of, and so pleased to see that it's on the edge of readiness. And in-house, with the Renfrew County Housing Corporation team, our community services caseworkers. Right now, we are diligently going through our transfer lists, our internal transfer lists, and we're also taking a look over at our centralized wait list and communicating with households that are on those wait lists to determine who will be able to move in to those new units. Again, we had the pleasure of welcoming many to a ribbon cutting ceremony on May 3rd. And within this item, you will see a link that brings you to the media release that was provided by Ontario. Next, we have an information item of a statistical nature, and this is regarding our community housing registry wait list. What we will see on this is that the cumulative application total is just under 1,500. Comparing this to the previous quarter that ended December 2023, we are slightly up. So December 2023, the wait list, the household wait list was 1,465, and we are now at 1,492. The trend remains consistent regarding the types of housing that are in need, and that would be mainly single-bedroom units followed by two-bedroom units. And the group of people that are requiring housing the most would be single households. The following information item, number 5, provides an update regarding move-ins, move-outs, and internal transfers within the RCHC properties. And the numbers here remain very consistent in comparison to the previous quarter. And for example, in the previous quarter ending out in December, the move-ins were at 15, and in this most recent quarter, the move-ins were at 14. Information item 6 provides an update regarding landlord and tenant board notices and applications. So within this, if we were to compare to the previous report, there are minor variances regarding the notices to terminate early, so that would be the N4s. However, cumulatively, when we calculate the number of notices for all properties throughout Arnprior, Renfrew, Pembroke area, very consistent. Last quarter, 258 were in Pembroke, and 255 were in Pembroke this quarter. Also, what you will see within this information item is a lack of information regarding evictions. So we work very diligently to ensure that every one of our tenants has a safe and affordable place to live at Renfrew County Housing. And of course, eviction mitigation is right up there on the list, trying to find ways to keep people stably housed. And this quarter, and again last quarter, we did not have any evictions to report on. Next up on the report is the Renfrew County Housing Corporation rent arrears. There are 2 attachments for your reference. Perhaps I'll bring your attention to page 18 that provides a comparison of the arrears. And I will note that arrears are up in comparison to December 2023. The cumulative arrears are up by $40,000. And this has been analyzed by our staff recently. And part of the analysis of it looks at how many cases do we have high arrears. So we consider high arrears to be anything more than 2 months' rent. However, high arrears that would be very concerning would be the arrears that would amount to be about $3,000 or more. So we don't have many cases that are at that rate. However, we have many cases, unfortunately, that have some level of arrears. We have strategies in place to try to get arrears down, for our financial end, because it's important, but also for our tenants, because as you can imagine, having this, debt looming over you would be very stressful. So it's very important for us at community housing to try to provide the wraparound support so that people are able to navigate getting their rent paid. And a few things that we have done recently have included removing the 2-month cap on retroactively reducing arrears once missing information is submitted. And in the last quarter, because of that strategy, we were able to reduce arrears just under $29,000. And although we are seeing, unfortunately, an increase in overall arrears, I suspect that it would have been higher if those other mitigation measures were not in place. Next, we have information item 8, and this is our final information item in this report. And again, pleased to announce another initiative that is MESA inspired, and this is the health clinics that are happening over at community housing buildings. The initiative is starting within the Pembroke area. So we have already had one health clinic on May 7th, and we have another one upcoming on May 21st at this location. And it was well received by the tenants. We had many attend. We initially had it booked for about 2 hours, and I think we were there 2 hours more than what was planned. Lots of great feedback from the tenants. To note, folks were not connected with medical services, and we suspected that, and that just reinforced the importance of bringing those services to them, close to home. And overall, we're looking to promote health and wellness, and this goes hand in hand with our commitment to provide safe and affordable housing. And with that, Chair, that concludes my report.
Thank you. We'll go back to information item number 1, the Treasurer's report. Are there any questions? Member from Whitewater, please.
Thanks, Chair. I just wanted to confirm, at the last County Council meeting, we had reviewed a letter that had spoken to some of the entanglements from the federal and provincial government to support housing. And in that, it was alluded that we may have to pause or not tender out some of the work that we had planned. I just wanted to confirm if that indeed has happened, or are we still on track to spend the money we committed to in the budget that we previously had?
Thank you. Ms. Patrick, please.
Thank you, Chair, and through you to Councillor Nicholson. I just let Ms. Dombrowski know that I would take this question because I do have it a note about communicating this in my report, but I'll take the opportunity to do so now. We did communicate following the council meeting, the council's enthusiasm and direction, I guess, to continue with our projects, and we have received confirmation from the federal government, from Minister Fraser, that funds will flow directly to the service manager that were meant to flow through the province of Ontario. So we don't have any details about exactly what that looks like in terms of the mechanisms, but we have been assured that the monies will remain. Thank you.
Any other comments on number 1? No. Information item 2, the 10-year housing and homelessness plan. Member from Petawawa, please.
Thank you, Chair, and through you. I'm looking forward to seeing the homelessness plan come out, whether it's September and October. My question is about the community survey. Is this something that's just going to go out on the county website, or are you going to be collaborating with all the 17 municipalities and getting on each of their social media? Just wondering how that's going to roll out.
Thank you. Through you, Chair, to the board. We are planning to use all media resources available to fully get this out to the community. So yes, to the 17 municipalities and the city of Pembroke, as well as the county's social media networks.
Any other questions on item 2? Item number 3, new construction, addition of rent geared to income units. Item 4, the 2024 first quarter community housing registry wait list. Member from Whitewater, please.
Thanks, Chair. Same question between 4 and 7 when we get to it. It's just this pattern is increasing. I think the number I had in my head was 1,200, so it's jumped to 1,500. Is that a pattern unique to our portion of the province, or is that something we're seeing provincial, that kind of jump by, what, 30 or 40% increase?
Ms. Dombrowski, please.
Thank you. Through you, Chair, to the board. We are on trend with the rest of the province and nationally as well. There is not enough affordable housing within County of Renfrew, nonetheless nationwide.
Okay. Member from Petawawa, please.
Thank you, Chair, and through you, I don't know if you can give us a sense of this number, but of the 1,492 individuals that are on the waiting list, do we know where they're living now while they wait to find affordable housing or community housing?
Ms. Dombrowski.
Thank you. Through you, Chair, to the board. Unfortunately, we do not have that data, and that is something that has come up with our data analytic conversations with our MESA approach, and that's a gap that we are looking to fill. What I can let you know is that about 95% of those households, the 1,492 households, they are located within Renfrew County now.
Member from Whitewater, please.
Thank you, Chair. It just infers more questions. At 1,500 people on the wait list, and we're assuming that these are the people who have decided, regardless of the time they might be on the wait list, they've decided to put their name on the wait list. Before, we were talking about a 7+ year wait on the wait list. Do we know how that might have extended now with this increase of 300 people?
Ms. Dombrowski, please.
Thank you. Through you, Chair, to the board. We do not have exact data on that. The data that we have on our website that provides an estimate of 7 to 10 years, and it varies based on bedroom size and location, is an estimate based on the move-in flow that we see. But no, we have not gone back to reevaluate that probably in the last 6 months.
Any other questions on number 4? No. Item number 5, the first quarter move-ins, move-outs, and internal transfers. Seeing none. Number 6, first quarter landlord and tenant board notices and applications. Item number 7, first quarter, the Renfrew County Housing Corporation rent arrears. Member from Whitewater, please.
Yeah, Chair, just if I can ask again how we compare either regionally or provincially with those kind of numbers. And I don't know if, Daniel, the outstanding arrears, second question, in terms of a percentage of anticipated revenues, what kind of basically accounts receivable do we have on that amount? Thanks, Chair.
So we'll go with the first question first. Ms. Dombrowski, please.
Thank you. Through you, Chair, to the board. So the question being, is the experience that Renfrew County Housing Corporation is having right now regarding the arrears trend, is it comparable to the rest of the province? And the answer is yes.
Mr. Burke, please.
Good afternoon, Chair, and through you, if I understand the question correctly, it's what would that be as a percentage of our revenue? So we take in approximately $5 million in tenant revenue, and we have only 150,000 outstanding, which is not a great percentage, though some of those tenants owe quite a bit, as you can imagine, and others not very much. But it's not. In terms of numbers, I'm not sure how many individuals would be owing us at any given time, but it's, as a percentage, not that high, but does contain some concerning tenants in there as well.
Thank you. Any questions on item 8, health clinics at community housing buildings? Member from Petawawa, please.
Thank you, Chair, and through you, I'm not sure who to congratulate or thank here, but this is another example of how the county and Mesa and our paramedics are innovating, all with the goal of helping our most vulnerable population. So I see this as an incredible innovation. My question is there a schedule in terms of where you're going next? I understand that you started in Pembroke, but that there's community housing all across the county, and even in my municipality of Petawawa, we have one community housing. Is there going to be a schedule so that folks will know where this is coming next?
Ms. Dombrowski, please.
Thank you. Through you, Chair, to the board. Excellent, question, because I get to answer to say that we are hoping to have this be a widespread initiative throughout the community housing portfolio. First and foremost, we are starting within the city of Pembroke with 3 properties. So the first is 260 Elizabeth Street, and then next it'll be 510 McKay Street, followed by 150 Elizabeth Street. So we're taking our time to see and measure some early outcomes and an uptake from the tenants to be able to evaluate how we move forward and how we may roll this out to other properties. So the intention is that once the 3 properties are fully scheduled in Pembroke with a routine, that we would then look to have that in another municipality, and again, centered around the apartments. We have 19 apartments across the county of Renfrew. No plans underway at this time to include the other 5 nonprofit housing providers, like you had mentioned, the one over in Petawawa. But I think it is a good idea to have that within the conversation. I think as far as ideas go and hopes, we would like to get the best quality of service and the most service out there to the residents of Renfrew County. However, we have limitations regarding capacity, and we are in a capacity building stage right now.
Follow up or
Supplementary?
Supplementary,
Please?
yes.
Thanks. Thanks for that answer. And just to follow up on that, this is a sector of our population that may not have family doctors. They're limited in terms of transportation and may not want to go. Everybody's facing long lineups at emerged departments and walk-in clinics. They may not have the wherewithal to want to go there and do that, or have the transportation to do that. So I think this is a great service, and it's great to see this started.
Yes, I agree. This is great, for sure. Any other comments on number 8? Okay. Oh, can I get a mover and a seconder to accept the director's report, please? Manager's report. Moved by the warden, seconded by the member from Whitewater. All in favor? Carried. Okay, I have nothing for new business. There's nothing for a closed meeting. The date of our next meeting is Wednesday, June 12th. Could I get a mover and a seconder for adjournment, please? Moved by the member from Head Clamariah, seconded by the member from Petawawa. All in favor? Carried. We are adjourned. Okay, I'll call to order the Community Services Committee meeting. Thank you very much for coming. Roll call is still good?
Yes, thank you, Chair, and we still have quorum.
Thank you. Could I get a mover and a seconder to adopt the meeting minutes from April 12th, 2024? Moved by the member from Head Clamariah, seconded from the member from Petawawa. All in favor? Carried. Delegations. I will ask Ms. Patrick to introduce our delegation, please.
Thank you, Chair, and through you to the committee. It's my great pleasure to welcome Kayla Mancourse, the Executive Director of the Eganville and District Seniors Association. She's here to provide us with a delegation about what her organization does in terms of supporting seniors and staying in their homes. And this committee may recall in a previous report, I had brought some information to this committee with regards to the Age Well at Home grant that we were very pleased to see the Eganville and District Seniors Association receive in order to try to grow some of their programs and provide even more help to the community. So we'll welcome Kayla up to the podium for the delegation. Thank you for being here.
Thank you very much for having me. I appreciate being here. So I'm Kayla Mancourse, Executive Director of Eganville and District Seniors, and we are a community support agency in Eganville serving the areas of Bon Shore Valley, North Algona, Wilberforce, as well as Admaston and Bromley. And so with a community support agency, we provide home support services to seniors to help them age in their home and in their community. And we're also a seniors active living center, so a physical location where seniors can come and do a multitude of different recreational, social, educational, fitness classes, a multitude of different things here in Eganville. And so that is a very, very brief, because I can talk for a long time about our agency, of what we do as a whole. But one of the projects that we started was the Age Well at Home project. So in the summer of 2022, we applied to the federal government for funding to be able to identify different needs and gaps in the communities. And we worked with our community partners with this. So it's actually a partnership between us, Whitewater Township, the Algonquin-Sepik-Wauknagan, and Barry's Bay and Area Home Support. And what we did was we looked at what programs we have and what services we're able to offer in our communities. And the question came up of, why doesn't everybody, regardless of where they live in these different areas, have equitable and same access to services? So this application had evolved from there, and it was really about looking and identifying those gaps, and so that anyone, regardless of where they lived in the townships, would be able to receive the same services. So there's services that, Eganville seniors may be able to offer or are offering, but people who reside in Palmer Rapids or Combermere may not be receiving those same services. So we're very fortunate last year to find out that we did receive the funding from the Government of Canada of just under $800,000 for a 2-year project in partnership with those organizations to be able to identify those needs and then also be able to morph and change to the needs of the community. So we were able to write this application and receive the funding enough to identify the key gaps, which was food stability. It was also transportation and homemaking and yard maintenance were the biggest gaps that we have seen in regards to helping seniors age at home in that community support type of atmosphere. And so we have the ability with this is to look at different models and different programs, but be able to adapt and change for each of the communities. What works well for those seniors who reside in Eganville might be very different than what the needs are in a community such as La Passe or Beachburg or Foymount. And so we really want to be able to evolve and change with this. And so this grant is a great opportunity for us to be able to come up with these program models, identify the gaps, and then not only that, but figure out a sustainability plan past this funding. So it is a 2-year project. It goes until September 2025. But everything that we're doing, we're looking at is when we no longer have this funding, how are we going to keep this going? We don't want to introduce a new type of service that is going to be taken away in September again. So those are all really big components. A big aspect of this was about volunteerism. And so when we wrote this application, initially the prerequisites were that there would be no staffing dollars included in this, that everything needed to be run by volunteers, unless there was extenuating circumstances. So many pages later of writing, we identified the extenuating circumstances. That when you're looking at these rural communities, and you're looking at an average of about 6 seniors or individuals per square kilometer, not 1 in every 6 is going to be able to be a volunteer. And so We were able to leverage this to be able to hire some staffing for that homemaking and the yard maintenance because we really wanted to make sure that we could provide those services. So those are some key of the components. We have started this. We have had a lot of discussions, and we've identified that the top two that we wanted to start right away was expansion of a Meals on Wheels program and frozen meal program. So Meals on Wheels program is a hot meal delivery out to the seniors at their homes. So there's flexibility again about whether it's a dinner time program or if it's a lunchtime program. But we looked initially at expanding of what's already there, and I'm very proud to say now that at this point in the project, that within 2 weeks, every single community from Whitney all the way through to La Paz, seniors will have access to hot meals delivery through this program. It's a very large area. We're looking at just over 4,700 square kilometers and a very, very large demographic, and it's due to the community partners that we've been able to have. We have navigators that are in each of the communities. So Barry's Bay Area Home Support has a community navigator because they know their community best. We have a navigator here in Eganville. There's a navigator at Algonquin-Pikwakanagan, and there's a navigator in Whitewater Township. Because a lot of that strength is from the community. They know the people that they need to reach out to. They know the needs in their communities, and it differs from community to community. The homemaking program was also one of the large gaps that we had in the community and that we have started, and it was effective just in January. And we have just over 100 individuals now, again, in that same demographic or geographical location from Whitney all the way through to Whitewater Township that is receiving homemaking services. So we looked at a lot of different models because this is one that is a little more difficult to sustain when we can't cover those costs past the funding period. But what we looked at was we first took people off of existing waiting lists. We worked with our community partners to identify those who have been sitting on a waiting list and needing these services, but have not been able to get the services due to their geographical location. So we've utilized those waiting lists, worked with those partners, and now we're working with a multitude of different partners throughout the area to make those referrals. So it isn't a service that we are offering out to the whole public because we really want to make sure that we are addressing the need to those who are most in need of this program. But this program is continuing to grow, and there's been a lot of big impact, and we've seen a lot of people being able to come home from hospital safely. And it's not a personal care, it's the homemaking. So it's things like light housekeeping, meal prep. There's a social aspect because we do have quite a few seniors who are very socially isolated. So it's really important to be able to bring that into effect as well. And then it's anything else that they may need assistance for in the home. So sometimes it's a short-term thing. They're coming home from hospital, they're going to need some help with some meals. They might need some help with cleaning up the yard outside, a multitude of things, but then they're going to get back on their feet. And then there's times where it's more long-term, okay? And it's bridging that gap between being able to live fully independently in your home and in your community, whether you're waiting for assisted living services or long-term care, it's a gap to be able to keep people safely in their home and in their community as long as possible. And so we're really proud of that program and how that's been growing. It's cost effective. We're able to just initiate a small copay, which is also due to the flexibility of the funding. We can also allow seniors who are not able to afford that copay to receive the services as well. So it has been an amazing program and a big impact in our community. The food stability program, so while we have focused on the Meals on Wheels because we had some models that we were able to look at, we're also looking at different ways to create food stability. So we're looking at a few different opportunities for frozen meals to help keep our costs down for seniors and delivery of those as well as pickup, working with some new community partners for that as well. We're also looking at different cooking programs. So for example, Eganville Seniors, we have a Cooking for One or Two program in partnership with ConnectWell because a lot of seniors are used to making big meals and now they're struggling to make those smaller individual meals. And with that program, we add that social aspect to say, okay, you've made one meal, but we're just going to double it and you'll have two. So let's take it to your neighbor who might not have come out, or, you know, have your daughter over for supper, something like that. So it's initiating some of that social aspect as well. We're also looking at different models in the different communities of, you know, cooking programs where everyone makes a pot of soup and then dines together, you know, or everybody makes a meal and then they're delivering it out to people in their community. So we're really looking at what strengths the different communities have and how we can leverage that to create these food stability programming throughout the county. One of the other barriers, is we're all very aware, is transportation in these small areas and in the county as a whole. And so we do have existing transportation programs in all of these areas, but we are looking at and evaluating of, you know, most of it is all volunteer drivers. So how do we continue to recruit volunteers? How do we keep those volunteers, and how do we make it fair and for the volunteers as well as the cost down low for the clients? So we're really looking at that as a whole picture and kind of trying new things and collecting a lot of information regarding the volunteerism and how we can make that stronger in our communities. So there's a lot of moving parts in this, but the big focus has really just been about identifying the need and having that flexibility to say, okay, I'm going to try this here, and then being able to collect all these different pieces of information to be able to share outwards. You know, we want to be able to share with other communities who have similar demographics of how we got this program, whether it be the Meals on Wheels or homemaking, whatever it may be, how we got that up and running, what worked, what didn't, how we edited it, and how we kept it sustainable past an $800,000 funding program. So again, a lot of moving parts, but something that we're adapting and changing and keeping us all very busy and on our toes for that. So there will continue to be always updates with that because it will be changing, and we look forward to continuing conversations with our community members and our partners to be able to really leverage what's existing in our community to keep these things going as they move on. So that's all I have.
That's a lot. Thank you very much. It's wonderful you talk about volunteers. We met last night at the Ontario Volunteer Award presentations at the Petawawa Civic Center, and I think many of them were from the Eganville seniors. Yes. And I can't remember the number, but they said the collective amount of volunteer hours of people that were in that room were like, I can't remember.
1,083.
Yeah, like a lot of years. We had one member from Laurentian Hills, and he had 50 plus years volunteering for the Snowmobile Club, so it's incredible. Thank you for this. Are there any questions that we'd like? Okay, member from Whitewater, please.
I was waiting to see if anybody else wanted to jump in there. So full disclosure, we are a partner with Kayla and her team, and thank goodness, because she's carried us on her shoulders, as with the other two municipalities, Pikwaktagon and Madawaska Valley. So big thanks to Kayla and her team who've done this grant. Kayla, I'm just going to get you to speak to just a little bit. You talked about rural, like 4,700 kilometers, 6 people per kilometer, these kinds of home support things that this grant is enabling you to do. Like, who usually does this? How does it usually happen if we don't have an $800,000 grant?
So some of the programs are already existing through our agencies, but there's an expansion need. So I'm going to use Meals on Wheels as an example. Eganville District Seniors, we have a Meals on Wheels program before this funding. It's a hot meal that we get from Rio's restaurant. It gets delivered out twice a week by volunteer drivers, and they're reimbursed their mileage for that. But we needed to expand out. We needed to be able to include more of the area that we weren't reaching. And part of that was also looking at the cost. So with this funding, we're able to offer a little bit more of a subsidy to bring the cost down, which is still a very affordable meal regardless. Barry's Bay and area home support, which encompasses, the South Algonquin, Madawaska Valley, Killu, Haggerty Richards, and Brudenell, Raglan, and Lindock. They had a Meals on Wheels program as well to start, but it was more contained to those who are in the assisted living program and within Barry's Bay. So with this funding, it gave us the opportunity in this navigator to be able to go out create more of the community connections, the restaurants in the different area, Palmer Rapids, Combermere, et cetera, the daycare in Whitney, to be able to put together this program. And then there's volunteers who are delivering out that meal. So it allowed us that staffing time and that extra piece to be able to really make those connections. And then in the township of Whitewater, there was no existing Meals on Wheels program. So how we leveraged that would be that we initially in Eganville Seniors had a Meals on Wheels, and we extended that out to Cobden so that we could get some more people. And with the community navigator that's there, has been able to make some more connections with community groups for volunteers and local restaurants to provide that service out to everyone in the community. So this funding allows us that to offset those costs of the mileage and whatnot that we would need to fundraise for anyways. But it's allowing us to do more of that, and it's allowing us to have that dedicated staff member who has the capacity then to really do that expansion. You know, we have a team member on board too who's looking at all the different volunteer pieces of, you know, how can we recruit and how can we train and what groups are we having and can we update our job description, and making all these things that tend to sit on the side of a desk for agencies that are already doing this work is being able to be done and looked at as a fulsome picture. So in terms of the Meals on Wheels, that's being serviced, transportation is being serviced, but how can we do better? How can we provide more information and giving us the capacity to do so? And then the homemaking service, there is different agencies throughout the county that provides homemaking services. It was just due to, you know, staffing and the geographical locations, it wasn't being serviced at all in our communities that we needed it. So the staffing is the biggest component and the struggle for that type of service. And we were able to recruit some of those support workers and be able to implement that out in all of the communities. So geographical location for that one is the biggest concern. So there are groups, it's just we have a lot of multitude of things, so evaluating and growing it allows us to do.
I'm going to ask a question. Do you have a strategy for how you get new volunteers?
So we're working on a fulsome strategy. It really erases, you know, we have the value of rural communities where people know people. So our biggest way to recruit volunteers is picking up the phone or talking to someone at the grocery store and really focusing on what the need is in the community. People want to give back, but they also want to be asked to give back. So that is, you know, our number one way of how we're recruiting volunteers is by, you know, going out and asking, you know, so-and-so, or we're seeing people with their grandparents and they're coming out to one of our, you know, our special events, our Mother's Day tea. And so we're having the conversations like, oh, you know what, we could actually really use some help doing, you know, this type of thing. You know, your grandparent or your parent is involved in the community and involved in our group. And so having that tie and that connection really helps with recruiting and retaining volunteers for us.
Councillor from Petawawa, please.
Thank you, Chair, and through you. Thanks for this. It's another incredible idea and an amazing service that you provide throughout the county. And you keep referring to us and we and our group. Can you give me a sense of who you actually are? Are you a nonprofit? How are you affiliated with these three municipalities?
Yeah, so we are, Eganville District Seniors is the we, and when we're talking about the entire age-well home project, the we and us becomes all of those community partners, because we really are working collaboratively. So for us, we're a community support agency, so we're funded through the Ministry of Health to be able to provide home support services in a nonprofit position to those people who reside in our catchment area. And the same thing for Barry's Bay and area home support. So they have their catchment area and they're funded to be able to provide these types of services as well. And then Whitewater Seniors is not funded by the Ministry of Health, but they provide a lot of the similar services through this funding and other projects that they're working on as well. And then Algonquins of Pikwakanagan have, you know, their resources available there on the First Nation, and they're able to, you know, expand and be able to provide more services through this. Does that clarify? Yeah. Okay.
You've used the term community navigator.
Yes.
Can you explain that one to me, please?
Sure. So with this funding, we're able to hire what we call the community navigator, and the intent for that is that it is a person in the community that knows their community the most. And that navigator talks to the seniors, talks to the volunteers, talks to the community as a whole to help identify where the biggest needs are, what they could work on, who they need to touch base with in the community, so those community partners and building those relationships. But also being that person that, if a senior is to call and say, I don't know how to get this, or I need help getting that, they are that person then that is able to connect them to the appropriate resources. And not just, here's a phone number, call them, but being able really to help them navigate their journey of aging in their community and aging with dignity. And so.
Thank you. Any other questions? Councillor from Whitewater, please.
Got 2 follow-ups. One at a time, though. And from a county perspective, think of it like Kayla's community navigators are like MESA teams specific to seniors and enabling them to be at home. They're connectors. They connect all the resources that might be available for them. The next question, I know that you're focused and the grant is focused on 4 areas, maybe a little bit bigger when we talk about Barry's Bay and it touches on KHR and Brudenell. How are you sharing that information, or those lessons learned, or the things that the lessons learned? How are you sharing those with the other communities? Like we have Head Clare, Mariah, Deep River, Arnprior, Renfrew. How do these other communities might be gleaming from what you're learning via this grant?
We're really in our infancy still. Like, we received the funding in September, but a lot of it was discussions and making sure that our first steps were what they needed to be to make the biggest impact. So we are compiling all of this information, all the different program models. We're looking out into other communities as well, where there's a multitude of different tables that we sit on to be able to share information, but also collect information of what's working in communities. And as we continue to compile this, we will be willing to share these resources and work with, when we say community partners, it doesn't necessarily mean in all those townships. It means community partners who are aligned with that same sort of work that they're doing. So that could be in different townships, that could be anywhere. We've talked about this program and this project and all these different moving parts at provincial conferences as well. And so to us, that's what community partners mean. And once we compile all this different data, it will be put together in a way that is out there and being able to be shared. But a lot of it right now is conversations and sitting at some of the same tables to be able to discuss and talk and share. Especially now that we're starting to see the programs running and going, we're actually learning things that we can share out, while at the beginning of the program was more of collecting what everybody else knew so we could really wrap our head around of how we need to get this rolling.
One more?
Last one.
Okay.
So if you had an ask from the county or from other agencies, what would you be asking for? What would you want in terms of assistance or support or even advocacy?
Community service agencies are really vital and important throughout the county. It's important for us to have everyone aware of what kind of services we do offer. We want that awareness out. We don't want to be working in silos. We want to be able to help everybody throughout the area. And so being able to create that awareness and share that awareness about what we do and the importance of what we do, and how we are part of that big healthcare picture. If you want to keep people out of hospitals, that aging at home and those services at home is what's doing that. If you want to keep people out of long-term care for as long as possible, this is a stepping stone for that. So a lot of it is about awareness and the acknowledgement of the importance of what we do as community service agencies and where we kind of sit in that big picture. There is a multitude of different struggles with that. We know the need is increasing. We're all relying heavily on volunteers. For example, Eganville District Seniors, we are completely volunteer run. So we have our staff in the front office that coordinates things, but every single program, every single service, everything else is run by volunteers. That is a funding thing that I will not fully get into at this time. But that is a struggle, and it's something that each of these agencies are very similar, and we all are in that same boat, and needs are increasing, and we want to be able to meet those needs. And being able to connect ourselves with community partners that are aligned in that thought and being able to work together is really the only solution to be able to fill that need. So that answers the question of that awareness and that community piece is, yeah.
Thank you, Kayla. Last one. Member from Petawawa.
You sure this is the last one?
Yes.
Thank you, Chair, and through you. So, Kayla, it looks like you're well on your way to creating a very useful and effective model as a way of delivering these services. And I'm not sure what's happening in all the other 17 municipalities across the county, but somebody in the government looked at what you're doing and decided it was worthy of providing this funding. I guess my question is, why aren't we all getting together, all 17 municipalities, plus Pembroke and Pikwakanagan, and sharing what your model is and perhaps mirroring what you're doing and everywhere else in the county, and then showing the different levels of government that look what we're doing here, and perhaps that'll open up more funding windows for all of our various senior programs that are going on, you know, whether they're alike or different everywhere across the county.
Definitely, and as this project continues and grows and whatnot, we want to be able to do that. I mean, our end goal and end sight would be that we are all working collaboratively, and all the seniors in every single area in Renfrew County is being serviced, you know, and equitably, where they can receive those same type of services. So it is definitely part of that picture of we would love to be able to get there. And so to us, we viewed it as here's a pilot project to be able to build this conversation and to build this, you know, proof of model and how it can work outside of this funding. So.
Great. Okay. Thank you so much, Kayla. Very informative, and I think we could probably stay another hour with more questions, but thank you so much, and good luck with all your funding and all the good work you do. Thank you.
Thank you very much. Thank you.
So I'd like to continue now with the Community Services Department report, please.
Thank you, Chair, and through you to committee. So the department report starts on page 5 of your package, and item number 1 is the Treasurer's report, which I will draw your attention to on page 10. Things are moving along very well within the community services budget. You will see that overall we are underspent by $137,000, just over, and so no areas of concern here. I'll just note a few things for this committee. With the Ontario Works budget, we are showing just over $340,000 underspent, and just a note that that is primarily due to some of the changes in staffing with respect to myself moving into this position and some of the delays around the backfill. Also, we did receive a one-time funding from the Ministry of Children, Community and Social Services, and some of those expenditures will be expensed closer to the third or even the fourth quarter of the year around some of the new projects that they had given us money for, around the one phone number system and digitized files, as well as for an employment services transformation lead, which we are in the process of filling right now. So things are underway, and will be starting to balance out as the year moves along. With respect to the childcare and community housing, both showing just, you know, overspent, $81,000 in the childcare, and community housing, $121,000. Those are primarily timing issues with regards to some reserve transfers. The childcare, there's a childcare mitigation reserve that has not yet been transferred, and with the community housing budget, there is an operating reserve that, there were several operating reserves that will be funding through different departments for MESA, and one being community housing, and that has not yet taken place. So those are just really around timing issues, and continue to keep this committee updated with spending trends, but we're on track there. Moving on to item number 2 is the Renfrew County District Drug Strategy Steering Committee. So in terms of staff, myself and Chief Nolan are participating, and as well Chair Giardini and Chair Donahue from the Health Committee are part of that steering committee. The first meeting was held on the 25th of April at the Pembroke Fire Hall. The intention of the steering committee is to guide the implementation of the Renfrew County and District Drug Strategy. The first meeting was well attended. There's a number of sectors that are represented on the steering committee, and that will be the document itself will be formed representing 4 pillars, being substance use prevention, treatment, harm reduction, and community safety. So we'll keep this committee updated as that moves along and see that come to fruition. Item number 3 in my report is a research project that is underway on ending chronic homelessness. So the Ontario Municipal Social Services Association, or OMSA, along with AMO and the Northern Ontario Service Deliverers Association, or NOSDA, are working collaboratively on this research project. They have engaged a consultant, Help Seekers Technology, who will be compiling the data and doing the work on the research project. The project has 3 main aims. They are aiming to quantify the scope of chronic homelessness in Ontario, to identify and cost out solutions at a provincial level to end chronic homelessness by 2030, and to identify the gap in funding between where we are now and what we would need to be at in order to achieve that. So the work is underway. They are engaging all 47 service system managers to pool data and provide input into this. And I know several of the managers here at this table have already, as well as some of our staff and data analysis staff, have already been involved with some of the meetings. And again, we'll keep this committee updated on the progress. They are hoping to have this research project completed and the report out by the end of 2024. Item number 4 in my report is a bit of an update on the National Housing Strategy funding allocations. As we spoke briefly about this in the Renfrew County Housing Corporation Board report, but I have attached in this report for your information as Appendixes 3 and 4 letters from both the federal and the provincial ministers of housing with respect to the funding, and the federal government letter from Minister Fraser does, as mentioned earlier, indicate that funds which were meant to flow through the province will be delivered directly by the federal government. And Minister Calandra's letter does indicate that the commitment remains there to continue to fund housing infrastructure in order for vulnerable individuals not to be put at risk. So that's the information that we have at this time. As mentioned earlier, we are continuing to move forward with the Coachie and OFI projects with Mr. Davis's team, and the COB, or the rent allowance, the Canada Ontario Housing Benefit, the rent allowance program. We have, it seems to be continuing. We have not heard of any interruptions. So that's the information that we have. Again, no details about how the money will be flowing, but we are continuing to move forward in that manner. And I'll stop there, Chair, before the resolutions.
Thank you. So we'll go back to information item number 1, the Treasurer's report. Are there any questions on that? None. Item 2, the Renfrew County District Drug Strategy Steering Committee. As Andrea mentioned, Chair Donahue, or Councillor Donahue, and I are on that committee, and it was a very interesting beginning. Look forward to that. I just got an email earlier this morning. I don't know if I can open up, but they've put a new dashboard on the Renfrew County Health District Unit website, and they will be tracking things that way. Councillor from Whitewater, please.
Yeah, thanks, Chair. Just a question on item number 2. The communication strategy for that committee, as it communicates back out to the municipalities within the county, as an example. Is that through our reps on the board, or is the health unit going to be responsible for those communications? Or do we know that yet?
I would think that, I'm not sure, but I would think it's through the health unit. I don't know that that was specifically discussed, but I can bring that back to find out what the communication strategy is for that. Thank you. Any other questions on that? Item 3, ending chronic homelessness research project. Item 4, the National Housing Strategy funding allocations. A member from Petawawa, please.
Thank you, Chair, and through you. Well, this is good news, I guess. I know we expressed a lot of concern about this last month, about the funding not coming at all and what we were going to do. So it's good to hear that it is coming. We are going to spend the money fixing the housing and keeping those rent subsidies in place.
Thank you. Okay, we'll go on to the resolutions, please.
Thank you, Chair, and through you to the committee. So the resolution, the first one is on page 6. It's item number 5, Association of Municipalities of Ontario delegation form. May I go ahead and read the recommendation, Chair?
Yes, please.
Okay, thank you, Chair, and through you. The recommendation is that the Community Services Committee recommends that staff review all options that are consistent with previous delegations and the 2023 to 2026 County of Renfrew Strategic Plan initiatives to put forward as potential delegations at the upcoming Association of Municipalities of Ontario conference.
Can I get a mover and a seconder, please? Moved by the member from Petawawa, seconded by the member from Head Clare Mariah. Continue with the background, please.
Thank you, Chair, and through you. So the deadline to submit delegation requests is June 7th, and wanted to get this, in front of this committee at this time, and seeking support from the committee to have staff go back and along with other members of the senior leadership team and our CAO to look at all of our priorities and our asks and formulate what we would like to put forward in terms of advocacy. I have listed here in the report some of the things that, of course, we are concerned about with respect to, needing increased spaces in our childcare centers around the CWELC, our MESA initiative and community wellness overall, increasing levels of affordable housing and revitalizing our buildings, as well as the low levels of social assistance rates. So we're looking at all of those and formulating maybe as a senior leadership team, and again with the CAO's direction, how to formulate and put those forward, and those are the areas that we're looking at.
Any questions or comments on this? No, all in favor? Carried. Item 6, please.
Thank you, Chair, and through you to committee. Item 6 is the Renfrew County Housing Summit, and I read the recommendation, Chair?
Please.
So the recommendation is that the Community Services Committee recommends that County Council approve the Housing Summit report as presented, along with the 12 key recommendations.
Could I get a mover and a seconder, please? Moved by the member from Whitewater, seconded by the member from Petawawa. Background, please.
Thank you, Chair, and through you to the committee. So as this committee is certainly well aware, we're very pleased to host on April 4th at the MyFM Center in Renfrew the first Renfrew County Housing Summit. We had great attendance and had a lot of great information presented by different presenters from different organizations. We received really important feedback and information from many of the attendees, and used that information to formulate into the Housing Summit report, as well as to identify 12 key recommendations. And I will just very briefly kind of summarize the 12 recommendations, but I know that the package is in front of committee. So recommendation number 1 is to explore development of a community improvement plan This is a tool that is authorized under Section 28 of the Planning Act and would really enable collaboration between municipal planners and economic developers to really help broaden community improvement and look at some of the financial incentives that would be available through that mechanism. Number 2 is to support the development of a real estate investment strategy. So as many of you saw at the Housing Summit, Mr. Davis's team has maps and good information about the vacant county lands, and those are available to be formulated into an investment strategy. Item number 3, increase funding and revise criteria for housing repair programs. That item would look to advocate with both the provincial and federal levels of government to augment funding and revise some of the criteria in order to help us continue to have sufficient funding levels to both revitalize our buildings and move forward with new builds as well. Item number 4 is around promoting and supporting the MESA initiative, which this committee is well versed in. Recommendation number 5, to incentivize private sector landlords to offer affordable housing. This is something that we do now, and looking to find ways to further incentivize landlords to really partner with us in order to provide rent supplements in the private sector to individuals that need them. Number 6, advocate for additional funding for rent supplement programs. Again, lobbying private sector landlords, additional funding for private sector landlords, trying to increase our RGI program through this type of mechanism as opposed to solely around the bricks and mortar that we own and maintain. Number 8, secure funding for housing repairs. And again, committee is well versed, I think, in some of the challenges that we face with these funding repairs and the need for increased levels of funding there. To address the interest rate challenges. So this was something that came loud and clear at the Housing Summit. We do have offer an affordable home ownership program. However, we traditionally have very low levels of uptake in that program. And that really prevents us from having a lot of flow through in our housing units, as people aren't able to move out of our community housing buildings into the next stage of housing due to some barriers. So this recommendation really is around looking at some of the eligibility criteria and rules in order that we may expand accessibility to that program. Item 11 is around the building condition assessments and compiling that inventory, which is well underway with an external consultant, and that is, as I say, is underway at this time. And then item number 12 is really just underscoring the importance of maintaining the funding for the Canada-Ontario Housing Benefit and the Ontario Priorities Housing Initiative and the Canada-Ontario Housing Benefit. And we, spoke about this, obviously, in looking at those potential concerns around those funding being stopped, and the need to ensure that we have that maintained on a go-forward basis in order that we can both maintain our units, build new units, and have uninterrupted access to those rent subsidy programs going out through COB. So perhaps, Chair, I could stop there and maybe, with your permission, invite if Mr. Davis has a little bit to add. I know his team has really been leading a lot of the work around the Housing Summit, and perhaps could add some additional information for committee here.
Mr. Davis, please.
Thank you, and through you. So I truly believe the Housing Summit was a great success for the Renfrew County as an organization to highlight the issues we're facing here within Renfrew County and beyond. One of the biggest things we talked about at the Housing Summit was the expression of interest. When we talked about the expression of interest, we talked about how can the county of Renfrew incentivize developers, investors to build more housing within Renfrew County. And because of that topic and discussion, a lot of good traction so far from the expression of interest. My staff and Andrea's staff have met with a number of developers already because of this. And so What we're hoping from this is to have some good initiatives coming on, I think it's June the 7th, when the expression of interest is finalized in the sense of timelines. And then we'll bring that back to committee for a review of the different possibilities of the developers that will bring to us. But overall, it's a good news story. The recommendations are solid recommendations to move forward with. One of the key ones, item number 11 with the BCAs. And we do know, I think we've talked about this at this committee a number of times, the conditions of our housing units and the recommendations that will be flowing through the BCAs. I'm hoping that this committee and county council will really look at this and to move forward with some of the things we talked about maybe divesting ourselves and maybe selling some units and building more units better and more of them. So maybe I'll leave it at that, Chair, and thank you.
Thank you. Are there any questions on the Housing Summit? It was a very well put together day, and even though it was snowing like crazy, there were a lot of people, lots of, and it was very obvious that the expression of interest was important to us. You made it very clear that, you know, we're open for business and we're very interested in partnering on many issues. Councillor from Whitewater, please.
Thanks, Chair. I echo your comments. It was an awesome opportunity. And I mean, of course, we've heard things over and over and over again, it feels like, but still, hearing things again helped me learn yet more new things. So I really appreciated that day. I had some questions and some comments with respect to some of the recommendations, and I didn't notice in there any mention to our 10-year homelessness and I can't remember the rest now. We just talked housing and homelessness plan. I'm assuming there is some interaction, but I couldn't tie it to one of those recommendations individually. I don't know if that was just an omission or if there was something that was, so anyway, I throw that out. The second one was, and you number them, but echo, the subparagraph echo, E, incentivizing private sector landlords. There was some mention at the summit about them saying, hey, we'll build the building, we'll build an apartment, we just don't want to manage it. So we'll just lease it to you guys, and you guys sublease it down or whatever. Has that been considered as an option and dismissed, or is it included in that language that's in ECHO as an example?
Mr. Davis, please.
Thank you, and through you. So we heard that loud and clear also at the event, during the event, and after the event. Developers do want to do housing, want to affordable, attainable housing, but they don't want to look after it once it's done. And so we will entertain that if that's a possibility, if that's part of an expression of interest. We've talked about it internally through our CAO, Craig Kelly, and Andrea Patrick, our director. That could be a possibility as long as we have capacity and all the external things to talk about when we look after an additional building. But it is part and parcel of the process.
Supplemental?
Awesome. Thank you, Chair, for this entertaining me. So the next one is just with K and talks about the BCA. And yeah, I can't wait to get that BCA report because I think it's just going to be a landmine. But in my mind, and tell me if I'm wrong, but BCA is going to say you're going to spend millions of dollars to fix these places up. So we should be able to, at some point, be able to say, look, the annual cost to have this door on a one-bedroom, including capital reinvestment and replacement and maintenance and administration, it's $25,000 a year. Well, then we just shop around and instead of us having to manage the infrastructure, maybe we go back to you build it, you own it, we'll lease it to you, we're going to give you $24,000 a year. We're going to save ourselves $1,000, and that'll be the administration piece. I don't think we need to own it. I'm like Jason, I don't want to sign on for more of these BCA problems 10 years from now. But I'm hoping that BCA, the BCA part, helps influence those incentives we're giving private developers to go into it with their eyes wide open and say, the right thing to do over a 25-year plan is you guys own it, we just buy the room from you for 15 years. Similar to what community living just did with us. Anyway, I throw that at the table.
Mr. Davis?
Thank you, Chair. Through you, and a good comment, good question. The idea of the BCA, we're hoping to have clear recommendations. Without going into too much detail of the individual units that we have and maintain, we do know what we'd call high-value land, low-value buildings that could be very well used within the expression of interest. When we talked about the expression of interest at the Housing Summit, we gave examples like that. We talked about the BCAs and what the expectations are going to be from the BCAs, and one of them could be to maintain the building, which is 60, 70 years old, is not worth it. And the recommendation from the BCA would be to the board of directors and the committee and county council would be divest that property and use that money somewhere else. Okay, thank you, Chair.
Okay, any other comments or questions on this? Okay, I'll call for the vote. All in favor? Carried. Item 7, please, continue on.
Thank you, Chair, and through you to the committee. So item number 7 is the final resolution in my package regarding City of Pembroke rehab facility funding. And if I may, I'll go ahead and read the recommendation, Chair. It is that the Community Services Committee recommends that County Council support the resolution from the Corporation of the City of Pembroke to establish a mental health, drug addiction, treatment, and residential rehabilitation facility serving the County of Renfrew.
Can I get a mover and a seconder, please? Moved by the member from the warden, seconded by member from Head Clare Mariah. Background, please.
Thank you, Chair, and through you to committee. So this motion was passed by the City of Pembroke Council on April 2nd, advocating to the province of Ontario to establish the mental health, drug addiction, and residential facility to service County of Renfrew residents. This committee is likely aware that we are, very under-resourced in terms of treatment facilities in Renfrew County. There are no women's residential treatment facilities and very limited men's. There's about 8 beds, I believe, at McCabe Manor in Renfrew, but many of our residents have to leave Renfrew County in order to receive residential treatment, and that is certainly a very challenging for individuals, and it is a barrier to them seeking help because then they lose their support systems and have to navigate in other communities receiving residential treatment. So the recommendation is that we support the city's motion in advocating for local treatment facility. Thank you.
Thank you. Are there any comments or questions on this? Member from Whitewater, please.
Sorry, and just so I can understand it, if one of these facilities was approved, would it flow through another organization that exists already currently in the county, or would it be an independent, another silo that we'd have here in the community?
Ms. Patrick, please.
Thank you, Chair, and through you to Councillor Nicholson. This was brought to the Health Committee this morning as information, and I will say that Chief Nolan has more background on this than I do. And I don't know the answer to that. I believe the thinking is that whether it be a facility in Renfrew County or towards the West End that's at least serving the community is advocated for in terms of how that would be run, who that would be run by. I suspect it would be through well, how other treatment facilities are funded, which we don't run any, so I'm not sure, but through Ministry of Health funding. So not sure exactly about the thinking of how that would be administered. Potentially there would be partners. We have McKay Manor, who is partnered with the County of Renfrew in the MESA initiative with their addictions treatment workers in our Renfrew Empire team. And they do operate a small scale and receive some funding to do so. But again, a very long wait list and a very small number of beds there.
Any other questions? Warden, please.
I can offer a little bit of background. The city was contemplating this motion the evening that the CAO and I showed up with Mr. Burke to talk about budget with the city, and they were suggesting that it should be located in the county. I suggested that I thought it should be serving the county. There's a bit of a distinction there because of the size of our population and potential clients. I wasn't sure because we don't have the numbers to know if there would be. And so there's actually the expression of the need for two separate services. One would be detox, and the other would be treatment service. The detox question, it's really hard to know what kind of numbers there are, because some flow through their doctor, the hospital, through some of the social workers and caseworkers in the community. Then others flow through parents and families driving them down. It's not uncommon to hear, when you're in a meeting interviewing somebody and they say, "Oh, I've been to detox 6 times and now my parents won't take me the 7th time." And so it's hard to tell what the numbers are. So I think that's part of what Dr. Morgenstern is trying to ascertain is the level of need. And so if there is enough demand here, that's great. If there's not, by locating it near the Empire border, either in Ottawa Carleton or maybe in McNabb Braeside Empire or over in the Pakenham area, then it could serve the 3 areas. And one of the things that works well for detox is a bit of a separation from the community, because there are stories of someone going off to detox without support, going on a bus, getting into a strange environment, and then not being able to avoid relapsing, within minutes, because they feel they need a boost to go to the facility. As soon as they walk through the door, they get a blood test or a sobriety test, and then it all falls to pieces. So it's an interesting question, and in terms of potential partners, McKay Manor is an ideal one. The OATC crowd is another ideal one if they're interested in expanding, and they have ready access to doctors and nurses as well. So I was talking to Councillor Lafreniere this morning, and she's going to a meeting with somebody who has a building that's interested. So there is a bit of a grassroots movement. So in terms of operation, you can have an operation by an arm's length partner from somewhere, from one of the facility or one of the services here in the county or outside the county, and they operate at arm's length with staff, and then it's a fee for service, and then there's some that are dedicated directly by the ministry, and some are tied to the justice system as well. So it's a bit of a hodgepodge in terms of models, but that's what I can give you off the top of my head.
Thank you. Any other questions or comments? No, I'll call for the vote. All in favor? Carried. Next is the Ontario Works Division report, please.
Thank you, Chair, and through you to committee. My Ontario Works report contains a few information items, starting with information item number 1, and that is regarding the Ontario Works caseload statistics for 2024. So as you can see, as of the end of March, our Ontario Works caseload, which includes our ongoing Ontario Works cases as well as our temporary care assistance cases, is at around 1,300. It is slowly increasing since last year, but this is as was forecasted based on labor market trends, unemployment rates, and existing social assistance caseload totals. Information item number 2 is our caseload composition stats So as you can see, the majority of our Ontario Works recipients are single individuals, as well as singles with children. So, and if you recall from our last report, you can probably anticipate that the highest volume of people that we are working with are living at the lowest end of the poverty scale, unfortunately, and are likely facing the highest levels of food and housing insecurity. So our caseworkers are working very hard on a daily basis to connect these individuals to supports and services to help them move forward. Information item number 3 is the Ontario Works outflow and inflow report. So this is just to show you the number of cases that are closed roughly on a monthly basis, as well as the number of applications that we receive. The number of applications that are reflected in this chart are the ones that are being received through the social assistance digital application platform. So this wouldn't necessarily include clients who contact their worker directly the month or 2 months after their cases have been closed. So there is some additional workload that's not reflected in this chart. Information item number 4 is the Renfrew County Community Risk Watch table stats from April 1st, 2023 to March 31st, 2024. And if you recall, the County of Renfrew became a member of this table as of April 1st, 2023. And I'll just give a quick little reminder about what this table does. So this table consists of a number of community partners who are working in the social services sector, including areas of mental health, addictions, law enforcement, to name a few. Basically, we come together every 2 weeks to discuss cases that we're currently working with, and each agency has an opportunity to bring forth a case that they believe to be a person or a family who's at acute elevated risk of harm to themselves or to somebody else. So the case is initially discussed with de-identified information, and then once the table votes, if there's a majority vote that all of the agencies at the table agree that the person is presenting at an acute elevated risk, further discussion happens with a smaller group of agencies who are determined to be needed to provide some follow-up to that person or family. So in the past year, the total number of cases that have been presented at that table were 24. The County of Renfrew was the originating agency 17 times. So when you're acting as the originating agency, we are the agency bringing forth those cases. We acted as a lead agency 15 times, and when we're a lead agency, we're just taking ownership and ensuring that the follow-up is taking place with our community partners, and then we're responsible for reporting the outcomes back to the table. And we acted as an assisting agency 3 times. So where another service provider has brought forth a case, we've been identified as an agency that should be involved in some follow-up activities. As far as closure results, in 9 of the cases that we have presented, the overall risk was lowered as a result of the follow-up that had taken place. In 5 of the cases, it was determined that the person was probably still at acute elevated risk, although they were informed of services, but we know that they don't always want to engage in services. In one case, new information suggested that the elevated risk wasn't present, so that can happen either in the Filter 4 discussion when some of the other agencies become, when we identify the information or the person, but it also, at the follow-up, we can identify additional information that suggests that there's no risk. And then for 2 of our cases, they were rejected and didn't pass through to any further discussions because it was determined by the table that the acute elevated risk criteria was not met. Information item number 5 is the Ontario Works Dental Program statistics. So the Ontario Works Dental Program is an annual benefit per adult member of $500 for dental services. Our dental program is administered through ASERTA, and it's completely digital, so there's not really a whole lot of involvement, but these are the results that are reported back to us at the end of the year. So there were 2,711 total number of adults that were eligible to receive dental support, and 627 claims were processed for a total of $67,806. Information item number 6 is regarding the Canadian Dental Care Plan. So as of May 1st, this plan became fully operational. They had started to accept applications since December of 2023, and the applications were age-based, so starting off with seniors over the age of 80 and 85. As of May 1st, they're starting to accept applications for adults who are 65 and over. And through the last few months, and as they've been implementing this program, they've been reaching out to local dental service providers to have them subscribe to the program. So this dental care plan is available for any adult who's filed their taxes with an annual income of lower than $90,000 and who doesn't have access to their own private dental insurance benefits. Really, really happy to see the province's decision to also kind of coordinate the Ontario benefits that are being offered with the Canadian Dental Care Plan. So what that means is that as somebody is accessing dental services, they will be billed first through the Canadian Dental Care Plan, and then any provincial plan that is in place. So for example, our Ontario Works Dental Plan would be billed secondary. So this could help to increase access to dental care for a lot of our recipients. And I'll also just say that we do receive a lot of calls from people who are not in receipt of social assistance for information about dental care plans. So this will be a really great benefit. Information item number 7 is related to the closure of the Warming Centre in Pembroke. So the Warming Centre in Pembroke closed on April 19th. A meeting was held at the Grind following the closure, and additional provisions and supports were provided by the Grind to the clients who were regularly accessing that program. We also have had a lot of presence from our MESA team. Our paramedics have been doing a lot of outreach and support to those clients who are continuing to sleep rough and sleep outside. And as was presented in the Health Committee this morning, our community mental health partners are also onboarded with that outreach as well. Information item number 8 is regarding the MESA gathering, which is taking place on May 22nd, so next Wednesday, at the Miramichi Lodge in partnership with the Renfrew County and District Health Unit, as well as the Upper Ottawa Valley Health Team. We're really, really excited about this event. We have over 100 people registered to attend. Really looking forward to the conversations and the collaboration, hoping to identify some recommendations and solutions as we move forward with our MESA team. And I did hear this morning that the registration for that event is now at capacity, so we're unfortunately not able to accept any more, but we're looking forward to the information to come. Thank you, Chair. That concludes my report.
Thank you, April. We'll go information item number 1, the Ontario Works caseload stats. Item number 2, caseload composition stats. Item number 3, Ontario Works outflow and inflow. Warden, please.
Thank you. So am I given to understanding that what I'll call walk-ins or referrals from local sources who call and the client comes over, they're not captured here? Is that a significant addition?
So I would suggest, for the most part, probably not. So a couple of years back, as you may recall, we moved to a centralized intake model. So we are trying to have all of our applications go through the centralized intake with the province. However, you know, in cases of immediate need, if somebody's experiencing homelessness or some severe, you know, financial need, we do have the capacity to support somebody right away. So in those cases, if somebody's launched an application with a caseworker in office, it wouldn't be reflected in this report. Yeah.
Item number 4, the Renfrew County Community Risk Watch Table stats. Item 5, Ontario Works Dental Program statistics. Item 6, the Canadian Dental Care Plan. Item 7, the closure of the Warming Centre in Pembroke. Member from Whitewater, please.
Thanks, Chair. I'm just wondering, based on the experience we've had this fall, and I think the date that was selected was based on funding or access to funding. Is there any other considerations that staff might recommend for when, if there was a future warming center, when it might, what might help indicate what date should be selected for closure?
Through you, Chair, I'll
Ms. Middleton, yeah.
do my best to answer that question. I think that conversation is going to be ongoing through the MESA developments, and as we kind of determine what the needs are, I would suggest that that will be our path forward.
Thank you. Okay. And item 8, the MESA gathering. No questions? Okay. We'll go on to the child care report, please.
Thank you, Chair, and through you to committee, good afternoon. The Child Care and Early Years report can be found on page 64 of your electronic packages. And my first 4 information items are related to statistics. We have looked at updating our statistical reporting to provide, hopefully provide a little bit clearer data for 2024. And these statistics all relate to information from January to March 2024. So information item number 1, licensed child care center statistics. So these numbers are related to the childcare centers throughout the County of Renfrew, and you will see there are a total of 30 centers open in the County of Renfrew. The licensed spaces, this again is the combination of the total capacity that all centers in the county are licensed for. The operating spaces column is the number of spaces that are actually operational with children in those spaces at this time. And then we also have the total children served on a monthly basis, and you'll see there's a little bit of a caveat there that this number is slightly higher than the operating spaces per month, and that is due to part-time programming in certain centers where multiple children might use the same space on a given day. So the one area that we discuss every time that statistics come up for childcare is the disparity between licensed and operating, and unfortunately that still remains to be quite a big gap, and is related to a lot of the staffing issues that are still out there in the workforce. Information item number 2, licensed home childcare agency statistics. So we've separated out the 2 licensed home childcare agencies. There are 2 in the county. One is directly operated by our staff here at the County of Renfrew, and the other is operated by the Petawawa Military Family Resource Center. And between the 2 agencies, there are currently 15 homes open. And with regard to licensed spaces, I just want to explain this number a little bit. So the County of Renfrew agency, we have a license capacity of up to 25 homes on our license, and the PMFRC has up to 40 homes, so a total of 65 between the 2 agencies. So the maximum number of children that can be in one of the homes is up to 6. So this is where this 390 comes from. It's a multiplication of the 65 homes times 6. Operating spaces, so the 90 is coming from those 15 open homes times 6 children, but you will also see that there is a discrepancy in the total children served that we can count. This is accounted for with a handful of temporary vacancies that are always being worked on to be filled, but the main discrepancy is related to the home provider's own children having to be counted in that ratio of 6. So just wanted to mention that. Information item number 3, Canada-wide early learning and childcare statistics. So we wanted to start showing a little bit of information with regard to the CWELC system in the County of Renfrew. So we do have, with the number of childcare centers and the number of licensed home agencies, a total of 32 throughout the county, but you will see that 30 of the 32 are enrolled in the CWELC system, and 2 are not. The CWELC eligible children of those 30 centers is noticed here, and you can see, I just want to remind everybody that the CWELC system only applies to children until they turn age 6. So this number incorporates all the children in that age grouping for the 30 centers enrolled. The non-CWEL children under age 6 is the number of children that are served in the 2 centers that are not enrolled. So just to kind of look at the total numbers, when you're looking at information on item number 1 and the total number of children served in the county of Renfrew, that 1,700, approximately 1,700 number, the difference between that number and these numbers is directly related to the ages of the children. So these numbers are 0 to 5, and then the discrepancy, the difference would be children 6 and older. Information item number 4, inclusion services statistics. So this chart shows the total number of children served who require inclusion services to support them in their licensed childcare programs. Information item number 5, annual childcare and early years professional learning day. So just this past Friday on May 10th, the Childcare and Early Years team hosted our annual Professional Learning Day for the whole sector in the County of Renfrew, which is better known as May Day. This was our 11th event and the biggest one yet. I am so proud to share that we had 434 attendees, which included staff from all of the licensed childcare centers, the licensed homes in the county, all of the early on child and family centers in the county, the staff and students from the ECE program at Algonquin College, program advisors from the Ministry of Education, as well as many of our community services staff. The theme for this year was becoming a behavioral detective, and we were honored to have Kim Barthel as our main speaker. Kim is an occupational therapist with over 40 years of practice, and she speaks across the globe. She shared the belief that all behaviors have a reason behind them, and when we look to understand these reasons, compassion can start to come into the equation. I am just going to say she was an extremely captivating speaker, and we have had so much positive feedback about her presentation. Also, as part of the day, we ran a donation drive for personal care items to be donated to victim services to help support our communities, and I am proud to also inform that we had over 1,000 items donated. I would like to thank Warden Emo, CAO Kelly, and Director Patrick for attending and bringing greetings to the group. This is always appreciated by them. And I also want to give a huge shout out to the team and all of the community services staff who worked really hard to make this day possible. You know, whether it takes a long time to organize an event of this size, and you know, from the setup to the takedown and the greeting at the door and the registration, plus all of the community services staff who stayed back and ran operations for the day. I just want to give a big shout out to everybody for that. We know how important professional learning is to the sector and how important it is for retention and recruitment and development of staff. So this day is really, really very important to the childcare sector. Information item number 6, Early On Child and Family Center Professional Learning Conference. So we recently had the opportunity to collaborate with 5 of our Eastern Region partners in Leeds and Grenville, Prince Edward, Lennox and Addington, Northumberland, Lanark and Prescott Russell to organize a joint professional learning opportunity for the Early On Child and Family Centers at the program staff there. The event will be held in Brockville on June 14th and is entitled The Foundations of Family Support, Strengthening Your Practice. This is a really great opportunity for the staff in the 8 early on child and family centers throughout the county to connect and learn and network with others in similar programs to theirs. So we are very happy to have had the chance to do this with them. Information item number 7. Updates to Ontario's childcare workforce strategy and the Canada-wide early learning and childcare system. So we received a memo from the Ministry of Education on March 28th to provide some updates to a previous memo that they sent to us in November 2023 about the childcare workforce strategy in Ontario. There are 5 updates that have been provided, and several relate to funding increases that we've received on a revised transfer payment agreement that you will see as a bylaw amendment a little bit later in my report. So the updates relate to workforce compensation. We had been informed in November 2023 that the wage floor for eligible registered early childhood educators would be raised to $23.86 per hour. So the funding necessary to do this was not included in our original 2024 agreement, and this incremental funding has been issued. Professional learning, so we're really excited about this. Specific funding and guidelines have been provided by the ministry to support the full sector in one paid professional learning day, which was very timely with our May Day event just taking place and having been planned. So we have always used pre-existing capacity funding for some of the costs associated with May Day, but this funding has allowed us to fully offset the costs for staff in all of the various programs for the day in recognition of the great importance of professional learning. Emerging issues was another item in the memo. We had received funding in our original 2024 transfer payment agreement for CWELC enrolled centres to identify non-discretionary emerging issues that they were experiencing, but the ministry has gone back and recognized that the original allocations were not sufficient for the full year and needed to be increased, so we're seeing a little bit of an increase there. There is a piece on value for money audits. The ministry has given some timeline extensions for these audits to be completed, and these audits are for municipal partners who directly operate childcare centres. We do not, so this piece does not apply to us. And the last item is startup grants. So this is regarding CWELC spaces. This additional funding is to assist with creating new CWELC spaces in communities and has specific guidelines. Unfortunately, we still do not have any new CWELC spaces to be able to add new homes or centres at this time, but we could consider some of this funding with pre-existing CWELC projects that might not be fully completed as of yet. There is a chart at the end of this information item to show the specific amounts that have been allocated in each of these areas for the County of Renfrew, and our total adjustment was $754,210. I'll stop there, Chair. The next item is a bylaw.
Thank you, Margot. We'll go to information item number 1, licensed child care center statistics. Any questions or comments? Item 2, the licensed home child care agency statistics. Item 3, the Canada-wide early learning and child care statistics. Item 4, inclusion services statistics. Item 5, the annual child care and early years professional learning day. Warden Emo, please.
Thank you. I just wanted to offer some comments and some congratulations to the Child Care and Early Years Division, and I know the whole department because I recognize some others. What a great day. Energetic, well organized, nice and upbeat, great speaker. You should be very proud of what you've done. It was, everybody was just excited to be there and to share and to learn, and as I said, a great guest speaker. I really enjoyed meeting her. And I'd also like to congratulate Councillor Service. Deputy Mayor Teresa Sabran was a great host, and your staff were quite accommodating and prompt in doing things. So it really contributed to the success of the day. So to you and to Deputy Mayor Sabran, if you could extend our comments to your staff as well. So, thank you.
Thank you, Warden. Item number 6, the Early On Child and Family Center Professional Learning Conference. Item 7, updates to Ontario's childcare workforce strategy and the Canada-wide early learning and childcare system. Always nice to get more money. Oh, Councillor from Whitewater, please.
Thanks, Chair. One quick question. I agree, love getting more money. The comment at the very end about CWELC spaces and how we might be able to use the $124,000, sorry, I'm struggling with language. The licensed home child care agencies, the homes, they're existing CWELC seats, but we can't use the 124 to expand from 15 to our current allocation of 60?
Through you, Chair, to the committee, unfortunately, no. Every space is counted, and we have no CWELC spaces that we are able to create, so this does tie our hands in that area.
Thank you. Any other comments? Okay, continue with the bylaws, please.
Thank you, Chair, and through you to committee. Number 8, Memorandum of Understanding, Early Development Instrument, Cycle 6. Would you like me to read the recommendation?
Please.
The recommendation is that the Community Services Committee recommends that County Council adopt a bylaw authorizing the Warden and Clerk to enter into a Memorandum of Understanding with the Ministry of Education concerning the release of information collected using the Early Development Instrument, Cycle 6.
Could I get a mover and a seconder, please? Moved by member from Whitewater, second by the member from Head Clare-Mariah. Background, please.
Thank you. Through you to committee. The Early Development Instrument, or I'll refer to it as EDI as we keep hearing, it's a questionnaire that's completed by kindergarten teachers for each student in senior kindergarten. Cycle 6 of the EDI collection was scheduled to start in 2021. Cycle 5 was in 2018, just for your information. But the collection in 2021 was delayed for 2 years by the pandemic. So collection of data began in the spring of 2023, and that data is ready to be released. So the EDI measures early child developmental health and well-being in 5 domains: physical health and well-being, social competence, emotional maturity, language and cognitive development, and communication skills and general knowledge. This instrument was developed by researchers at the Offord Centre for Child Studies in McMaster University, and it's used as a measure of whole populations based on geographical or administrative boundaries by the ministry, municipalities, school boards, and community organizations so that it can help inform decision-making and planning for early years programs and services. So this memorandum requires signature to be sent back to the Ministry of Education in order for the data for the County of Renfrew to be released to us for review and analysis.
Are there any questions on this? No? All in favor? Carried.
Thank you. So item number 9 is the Ontario Transfer Payment Agreement 2024 Childcare Early On and CWELC Revised Schedule. I'll read the recommendation.
Please.
That the Community Services Committee recommends that County Council adopt a bylaw to amend Bylaw 17-13, being a bylaw to execute the Ontario Transfer Payment Agreement with the Ministry of Education for the 2023 to 2027 Childcare Early On and Canada-wide Early Learning and Childcare Service Agreement to accept a revised 2024 Childcare Early On and CWELC Transfer Payment Agreement with the Minister of Education.
Could I get a mover and a seconder, please? Moved by the member from Whitewater, seconded by the member from Petawawa. Background, please.
Thank you, Chair. Through you to committee. As mentioned earlier in more detail in information item number 7, when I was talking about the memorandum from the Ministry of Education, we received a revised transfer payment agreement on May 2nd that incorporates the additional CWELC funding allocations to the County of Renfrew for 2024, and the total change is an increase of $754,210.
Any comments or questions on this? Seeing none, all in favor? Carried. Okay. Could I get a mover and a seconder to accept the reports, please? Moved by the member from Whitewater, seconded by the member from Head Clare-Mariah. All in favor? Carried. I have nothing for new business. There is a closed meeting. Be it resolved that council move into a closed meeting pursuant to Section 239(2) of the Municipal Act 2001 as amended to discuss the security of the property of the municipality or local board, the Old Grove or in Prior. Mover and a seconder, please. Moved by the member from, by the warden, seconded by the member from Petawawa. All in favor? Carried. Thank you. The date of our next meeting is Wednesday, June 12th. And could I get a mover and a seconder for adjournment, please? Moved by member from Petawawa, seconded by member from, they're all pointing over there, member from Whitewater. All in favor? Carried. We are adjourned. Thank you.